Welcome back to the Pink Couch series. I'm Dr. Elizabeth Arguelles, a board-certified breast surgeon at Southwest Florida Breast Surgery.
And my name is Amy Van Osdale. I'm a board-certified physician assistant who works closely with Dr. Arguelles at Southwest Florida Breast Surgery. Today we'll be talking about breast imaging. So we have mammograms, ultrasounds, and MRIs. Mammogram is the first screening tool, and everybody should start at the age of 40. Can you please explain the importance of mammograms for us?
So a mammogram is a low-dose x-ray of the breast. Like Amy said, you should be starting at age 40 and having a mammogram every year. Unless, of course, one of your family members had breast cancer much earlier. Then you should be starting 10 years younger than the youngest relative that you have. Mammograms are the only screening modality that can actually detect calcifications, which can be the first form of breast cancer. So catching it at its earliest stage when it's most treatable.
So sometimes patients are worried about whether the mammogram is painful or even the dose of radiation that they can be exposed to when they get the mammogram.
So one of the tricks that I say is, number one, if you're worried about it hurting, take a Tylenol, take a Motrin before you go. It's a quick exam, under a minute. The radiation dose is low. They've upgraded and enhanced the technology so much that the radiation is actually less than if you took a flight to New York from Florida.
Excellent point. So then sometimes even they'll go a little bit further and say, well, why can't I just get an ultrasound?
Again, the reasoning behind the mammogram is that you want to find the cancer at the earliest stage. Ultrasound is great. It's painless. You can do it while you're laying down. Your arm is up. It's a quick, cheap, easy modality, but what it's really telling us is it's looking at the sound and how it travels through the breast. So it's telling us if there's a solid mass or a cyst or something like that. So it is useful and it can be helpful in addition to a mammogram that's inconclusive, but it's definitely not the first recommended screening test. Now, have patients asked you about when their breasts are really dense, if there's any other screening tests that can be done for that?
So on your mammogram report, the radiologist will indicate how dense your breasts are. If they say you have dense breasts, then that's just the way your breasts are made, but it can sometimes be hard to see certain things on the mammogram. So they might say you qualify for screening MRI. Can you tell us a little bit more about the MRIs?
Absolutely. So MRI is a imaging test that is done through a magnet, so there's no radiation actually given. It is the most comprehensive look at both breasts and the lymph nodes and the chest area. It detects 17 cancers per 1,000 women screened versus 4 cancers per 1,000 mammograms done, but it's also more expensive, so it's not right for everyone. Patients who do have more gland versus fat in their breast are going to have dense breasts, and those are the women who should potentially have the MRIs. Women who have a genetic predisposition to developing breast cancer or who have an overall lifetime risk greater than 20 to 25% should be considered for screening MRIs. If you see something, if you feel something, if you had an abnormal mammogram, you want to come to a breast surgical specialist and talk to your doctor about what is needed for you. What do you need to do to get your diagnosis? And if you're diagnosed, find the team that you're comfortable with, talk about your options so that you can get the best possible care to have the best possible treatment outcome.
Thank you, Dr. Arguelles, and thank you guys for joining us in the Pink Couch series, and we hope we see you next time.